please rise and join me with our chaplain, John Gerhardt, will give the invocation.
Thank you, Chairman Carter. Would you bow your heads with me for our prayer? Lord our God, the Psalms encourage us to enter your gates with thanksgiving in our hearts and to enter your courts with praise. And we have much to be thankful for on this beautiful fall day. We thank you for the freedom and the opportunities that exist in our nation. We're thankful for this beautiful city we are privileged to call home. For the blessings of our friends, our families, and our health, we give thanks. And we thank you for the high privilege and the sacred honor we have to provide the very best of care for our neighbors in this community who often find themselves in the greatest of need. We ask for your hand of favor, direction, and blessing in all our affairs. As we give thanks together, these things we pray. Amen.
Please join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I want to call to order the meeting of the Sarasota County Public Hospital Board, and I'll start by reading a statement, a comment. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. I understand that we have a few additions to the orders of the day.
Mr. Chairman, I'd like to propose an addition of action items to the orders of the day. I move approval of the additions of a motion to approve an amendment to the SMH medical staff credentials policy as item Roman numeral 7A on the agenda, and a motion to approve the grant of authority to administration to effect the purchase of 2 units in Doctor's Gardens as item Roman numeral 12B, subparagraph 5 on the agenda.
Do we have a second? Second. We have a motion and a second. Any questions or comments? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you. Now we'll move to the approval of the minutes of the meeting of October 16th.
Mr. Chairman, I make a motion to approve the minutes.
Okay.
Correction. I need to withdraw that because I was not in attendance at that meeting, so I'm not at liberty to know what truly happened there, so I should not be making that motion.
Okay. Good. Thank you. All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Thank you. Motion passes. Under board reports, as you know, this is our annual organization meeting, and at this meeting we elect the officers of the board. Chairman, first vice chairman, second vice chairman, secretary, assistant secretary, treasurer, and assistant treasurer. Do I have a motion for the election of that slate?
Mr. Chairman, as secretary, I would like to propose the following slate of officers. As chairman, Joe DiVirgilio. As first vice chairman, Bill Noonan. As second vice chairman, Jim Meister. As secretary, Tram Hudson. As assistant secretary, Susan Tucker. As treasurer, Sharon Wetzler DePeters. And as assistant treasurer, Daryl Henry.
Do we have a second?
Second.
We have a motion and a second. All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? The motion passes. Thank you. At this time, I'd like to say that I have really enjoyed the past 2 years as chair. There's a lot of things that have happened over the 2 years, and it's been an opportunity for me and a privilege to be chair. A lot of the things that happened are, matter of fact, all are teamwork, and that's one of the things that I've really gotten to see deeper over the past 2 years, is the teamwork from all the different entities, from the C-suite to the management. I've had opportunities to do night rounding, to talk to the nurses. I've gotten involved in the GME program. There's so many components that make this such a great place. So, at this time, I'd like to pass the gavel to...
Mr. Chairman?
Yes.
Can I say something before you pass the gavel?
Sure.
I had brought this up this morning for our board, and I think I know that I speak on behalf of my board colleagues to thank you for your leadership, your commitment of time and energy, and for your patience, and as you say, flying below the radar, but getting it done. And you've done an outstanding job. And
Couldn't agree more.
we're all appreciative, and I'm sure the residents of the county are very happy to have had you. Thank you.
Thank you. So, at this time, to make it official, I'd like to pass the gavel to Joe DiVirgilio. And Joe, you have my best wishes and my support on everything. And congratulations, Mr. Chairman.
All right. Don't forget your name tags.
Well, Greg, you've covered a number of things that I intended to cover here. You being very humble in your kind of statements of the things that have been accomplished under your leadership. Jim Meister has covered some of it, and you also, but I think I'd like to take a few minutes, if you don't mind, just to go over just some of the superior accomplishments under your leadership as chair. He's been on, Greg's been on the Sarasota County Public Hospital Board for 15 years and has served as chairman twice, including this past 2 years. It's really marked a period of really tremendous growth for us. We've completed a master facility plan on the main campus. The opening of a critical new facility, including rehab pavilion and urgent care centers throughout the region. You've presided over the successful launch of the hospital's new trauma center, the FSU Physicians Residency Program, and the opening of the Newtown Internal Medicine practice. It's amazing when you look back over the last 2 years, the things that have been accomplished with that. On a personal note, I think you've really established a standard for this office that hopefully I'll be able to reach to and address. I mean, you personally interviewed all of the physician residency candidates, which is amazing to me, and have agreed to continue to do that with the next residency program that we're considering. Greg mentioned that he has gotten around quite a bit of this campus and the outlying areas. He not only did a lot of rounding and visited each office, but he also made sure that the night shifts here were not forgotten and spent many long evenings here with staff, getting to know each of them. He's been a great champion of medical staff themselves, demonstrating ongoing support of our activities and top quality care. He's played an important role in strengthening Sarasota Memorial's partnership with the community and governmental partners, actively participating in organizations such as the Council of Governments, and repeatedly and tirelessly traveled to Tallahassee to advocate on behalf of the hospital on key healthcare issues. Something tells me you're not going to miss that trip at all. During his tenure as chairman, Sarasota Memorial was continually recognized for its superior care, earning a 5-star quality rating from CMS, multiple magnet nursing designations, U.S. News Report recognition, the Gallup Great Workplace Award, Leapfrog A grade in patient safety, Truven Top Hospital honors, and many other national awards. So Greg, we can't say it enough, but thank you. Congratulations on all of those successes, and we look forward to that leadership being continued here for a long time into the future. Thank you very much.
Thank you. It's not just the chair, it's the board that oversees all of this. It's the entire system that gets all of these things that you just mentioned done. It's an absolute team effort by everyone, and I've enjoyed it. Thank you, John.
Again, thank you very much. Alrighty, getting back to the agenda here, we're going to have a SMH Rehabilitation Services update. Alexander Bayork? Got it close. That was a good one. There you go. Well, DiVirgilio, I'm used to kind of people getting it close, you know? If you would, you're on.
Very good. Well, I just want to thank the board for the support to our program and for inviting me to kind of present what I think are some exciting achievements and developments in our program recently. And before we do that, though, I'd like to take a moment and just explore what it is we do within the larger continuum of healthcare here. And I want to do that by talking about a story of actually one of my patients recently. So about 1 month ago, a 23-year-old young man was riding his ATV bike with some friends when at 50 miles per hour he lost control and rolled several times. He was not wearing a helmet and landed on the back of his head. Bayflight Emergency Services brought him to our emergency department, where my colleagues in acute and critical care stabilized and intubated him. Systematically, a group of various specialties, including neurosurgery, trauma surgery, examined his brain, his bones, his organs to ensure that he survived the accident, and they were successful. He had his breathing tube removed and his eyes began to open, his vitals stabilized. However, at this point, injury to his frontal lobes had made him very agitated and very restless. He was rocking side to side in his bed, had blurry vision, was moaning in pain. He wouldn't eat or drink. He wouldn't speak unless spoken to, and only a couple words at a time. His family began to wonder what his future would hold. They began to wonder and worry if he would ever grow up to become a man, to become a husband, or to become a father. It was at that time that he arrived at our doorstep. That doorstep is our new rehabilitation pavilion, and it's where I work as a physical medicine and rehabilitation specialist. So I work with a team of nurses, case managers, physical, occupational, and speech language therapists to assist patients in returning to an independent and productive life. So we collaborate to develop and implement essentially an individualized but holistic rehabilitation approach to care. We take care of patients from brain injury, spinal cord injury, amputees, cancer rehab, trauma, burns, and even fractures and orthopedic joint replacements. And our pavilion has been meticulously designed to prepare patients for the home setting, from functional closets and furniture simulated to residential surfaces, to our outdoor mobility garden, to a simulated car that they can practice getting in and out of, to a mock grocery store where they can practice taking out groceries, and to a practice apartment that you can see here in the upper right-hand corner where they can actually practice staying the night in their own apartment. The new pavilion opened in April of this year, as you know, and within 48 hours of opening, it was at capacity, 44 beds, which was an increase from 34 beds in the East Tower. It is available as a tertiary care continuum for patients unable to be discharged home and into the community. We plan on submitting for 10 additional beds in the fall of 2018. We have recruited, myself included, FPG-employed physicians of PM&R, a new medical director, 2 nurse practitioners, and we are in the process of interviewing 2 more candidates for the 2018 late year. We are training our therapists additionally in specialty certifications in neurology, brain injury, and in stroke. Just recently, we underwent a CARF accreditation survey. So this is an international nonprofit organization that surveys rehabilitation programs for quality improvement. So the surveyors spent 2 long days analyzing over 2,800 separate CARF standards, and they had exactly 0 recommendations for our program. That was their first ever deficiency-free survey. So it's that kind of excellence that I think sets this rehabilitation program apart from others in the area. It makes it an exciting and dynamic place to work for me as a physician, and most importantly, it creates patient opportunities to recovery. So if you remember that patient, the 23-year-old with the traumatic brain injury, 3 weeks later, he walked out of our rehab pavilion. He was talking, he was smiling, he had some deficits that he'll continue to work with for months and for years in vision, a little bit in memory, but he was able to walk out and start his future. And he has that future because of this hospital, from the emergency department and the trauma team there, to the ICU physician, to our team of multidisciplinary therapists. And I think that our pavilion is an integral part of that continuum of care, and we will only continue to grow. And I thank you again for your support of our pavilion.
You can, if we have any.
Yep.
All right. Well, Doctor, thank you and congratulations.
Thank you.
Joe, I don't have a question, but I have to state.
Darrell, go ahead.
I am currently an outpatient in the rehabilitation pavilion. It's about as good as it can get.
Thank
I've
you.
been through a bunch of it, getting this far. Some of you may remember where I started from, but people that are there now were there when I started. They know where I came from, and I'm certainly pleased and very satisfied to recommend this facility to other people because it's done so absolutely much for me.
Thank you, sir.
Darrell, thank you. All right, next, David, I guess presenting the Excel Award. David?
Thank you, Mr. Chairman. Pleased today to introduce you to our November 2017 Excel Award, Kevin Hardcastle. Kevin, and join me. Congratulations. So Kevin Hardcastle is our November Excel Award winner. He's an RN with the Center of Wound Healing and has worked at Sarasota Memorial since 2007. Kevin is known as someone who goes out of his way for coworkers and physicians. His peers describe him as an amazing nurse who always presents himself in a professional and positive manner. His skills in wound care, wraps, and compressions exceed standards, they say. He has a knack for identifying and diagnosing clinical and social issues that enables him to generate the most therapeutic plans of care. His coworkers also describe Kevin as eager to research and learn all the latest advances in wound care. He often shares his findings with staff and patients, and his enthusiasm shows. His coworkers say the first thing many patients ask when they enter our unit is Kevin working today? Kevin, thank you for everything you do, and congratulations. Thank you.
If I can, Mr. Chairman, I'd like to recognize Jim Tollerton, who is a former board member and also the founder who endowed this award, for being here. So thank you for being in the audience. Kevin, this is the Excel Award. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers that make an extra effort in the quality and care of our patients and families in the community. The hospital board and administrative staff of Sarasota Memorial Healthcare System recognizes Kevin Hardcastle with the Excel Award for the month of November 2017, signed by David Verinder and our former chairman, Greg Carter. So congratulations. Don't squeeze too hard. Say a few words. You gotta make a speech.
Or a speech.
I heard you say earlier about teamwork, and that's my favorite thing about working for this hospital is the team of people that I work with. I've often told coworkers and even patients, you know, the best thing about having a great job is the team of people you work with. For me, that's everything. It's not so much what I'm doing, it's that team. We always do more together than we do by ourselves. It's a privilege to get this award, and I was really surprised. My coworkers, I love working with them so much. It's like having a family. So, thanks again.
Great job.
David, if you would, continue with the Physicians Excel Award.
I thank you, Mr. Chairman. So I am also pleased to get to recognize our Physician Excel Award for the third quarter 2017, and I'd like to invite Dr. Joelle Valhakis to join me. Joelle Valhakis is our Physician Excel Award winner for the third quarter 2017. Dr. Valhakis is a medical director of supportive care services and an associate director of medical care management, and she's been on our staff since 2015. Dr. Valhakis' nomination, I hope I'm pronouncing that. Okay, thank you. You're very kind. Nomination describe her as perfect blend of professional acumen and sincere compassion. She's a gifted communicator of often difficult information, which makes her such an asset to supportive care services. Her peers describe her as genuine and genuinely present, honest and approachable, respectful, an exceptional patient and family advocate. A nurse who nominated Dr. Valhakis says, she makes such a difference in our ability as a nurse to care for our patients and help them cope with their disease. Another peer says Dr. Valhakis has the amazing ability to manage complex end-of-life and palliative care situations and communicate with multiple providers, clinical staff, and family members, always in a present light. And I'll just close by saying, Joelle, we received many complimentary nominations, which are too many to read today, and we so much appreciate everything you do for our organization, our patients, and our community. Thank you so much. Congratulations.
Doctor, it's a privilege to present this Excel Award for the Physician of the Quarter. Excel recipients are physicians who are recognized as role models of excellence, superior in performance. They are leaders who consistently demonstrate a collaborative team approach in their work. These individuals strengthen the quality of patient care and the image of Sarasota Memorial Healthcare System in our community. The hospital board and administrative staff of Sarasota Memorial Healthcare System recognizes Joelle Valhakis. Did I get it right? That L had me.
Yeah, it shouldn't be there, should it?
Joelle Valhakis. All right, with the Excel Award for the third quarter of 2017, signed by David Verinder, President, CEO, and our former chairman, Greg Carter. Congratulations. Great job. The microphone is yours.
So thank you so much. I know we said 5 minutes, and I tend to be an over-communicator, so I'm not going to do that. It's a real privilege to work here. It really is. And actually, I've been on staff since 2000, but in this position since 2015. And there's not a day that goes by that I don't pinch myself that I get to work here. The patients, the families, and the people I get to work with every day. Every day. What a gift. Thank you.
Thank you.
Alrighty, next up is the report of the medical staff, Chief of Staff, Dr. Carl Gardner.
Yes, thank you, sir. Just wanted to give an update regarding the Medical Executive Committee's current recommendations to help facilitate physician communication in light of IRMA and other issues that help to, we want to make sure that there's good ways to reach physicians in the community on medical staff for emergencies or other necessities. So one of the recommendations that the Medical Executive Committee made was to require physicians to provide their current cell phone as part of their credentialing policy. And so that is the recommendation that we have brought here today.
Yes, Mr. Chairman, on the basis of that, as a board member, I move approval of the amendment to SMH's medical staff credential policy, section 2.B.1. to add a requirement to maintain a current cell phone number with medical staff office. This is recommended by the Medical Executive Committee. I so move.
Second.
We have a motion and a second. Any discussion? Hearing none. All those in favor, please signify by saying yes.
Yes.
Opposed? All right, motion passes.
Thank you.
Anything else, Doctor?
No, sir.
All right, we're all set. Next, we have a foundation report. Mason Ayers.
Thank you, Mr. Chairman. Got a brief report for the board. I just wanted to make everyone aware that the next edition of Envision magazine, which is the magazine that the Healthcare Foundation sends out 3 times a year, has been sent out to the residents of Sarasota County. And this edition's lead story features the graduate medical education program. And we are fast working on the next edition, which is scheduled to go out in February 2018. So that concludes my report, Mr. Chair.
Thank you, Mason. Next, Secretary's report. Tram Hudson.
Mr. Chairman, I have a report of the meetings to be held over the next 40 days. On Thursday, December the 14th at 9 a.m., the Human Resources Committee of the Board will conduct the CEO review. That will be held here in the Waldemere building in the Harrison boardroom. On Monday, December the 18th at 10:30 in the morning, we will have the Mission and Planning Committee meeting. At noon, we will conduct the peer review meeting. We will conduct a financial review between 12:30 and 1:30, and at 2 p.m. in this room, we will have our board meeting. On Thursday, January the 4th at 9 a.m., we will have a 3-hour meeting of the Mission and Planning Committee here in the Waldemere building. That is all I have to report, Mr. Chairman.
Thank you. Next up, Treasurer's report. Jim Meister.
Yes.
Contrary. Oh,
Then
I-
replaced by.
Yes, I
by
apologize, Sharon.
Peters. In relation to item 10A on the agenda, item summary is approval of bad debts and charity care. I move approval of the bad debts and charity care for the month ended October 31st, 2017, in the amount of $23,058,000.
We have a motion and a second. Any questions, comments? All those in favor, please signify by saying yes.
Yes.
Opposed? All righty, motion passes. Thank you, Sharon, and congratulations.
Thank you.
All right.
Thank you for your work, Jim.
Next, we have the financial highlights for the month. Bill Wojcik.
Thank you, Mr. Chairman. Good afternoon, everyone. So I have October financial highlights, with October being the first month of our financial year. The fiscal year-to-date numbers are the same as the monthlies, so I won't cover the fiscal year-to-date. Starting with operating revenue for the month of October, we had $63,678,000 of operating revenue, compared to a budget of $61,701,000. Our total expenses came in at $63,494,000, compared to a budget of $63,138,000. Our operating income in the rating agency format, $3,536,000, compared to a budget of $1,913,000. The operating margin for October was 5.2%, compared to an operating margin budget of 2.9%. Looking at some of the statistics, for the hospital, the average daily occupancy, 486 patients compared to a budget of 483. our admissions, 2,839 compared to a budget of 2,709. Our acute average length of stay was 4.48, and that compares to the prior year of 4.51 days. Continuing with the hospital statistics, surgery cases, 1,994 compared to a budget of 1,803. And we had 293 births in October compared to a budget of 279. The hospital's outpatient registrations, 37,478 compared to a budget of 36,419. And registrations in our 2 emergency care centers totaled 9,992 compared to a budget of 10,027. And our case mix index, so far this year, just 1 month, 1.84 for all patients compared to 1.96 for Medicare patients. This will continue to move along during the year. Are there any questions? That concludes my report.
All right,
Thank you.
Thank you, Bill. Next up are our committee reports and Governance Effectiveness Committee. Greg Carter.
Thank you, Mr. Chair. The Governance Committee met earlier today, and we started with the election of the board officers who are now in place. And we moved next to our board meeting calendar for 2018, presented by Karen Marshall, our secretary. Then the corporate compliance update, Lisa Totten gave that report with the discussion and talking about the makeup of the corporate compliance is the CEO, our chief legal officer, our compliance officer, and the board chair. And we talked about the different elements of the CHC that go over standards and procedures, oversight, education and training, auditing and monitoring, reporting, and enforcement and discipline, and responses and prevention, and lastly, risk management. Then Lisa covered the board self-assessment with the discussion, and we scheduled a meeting for another meeting to discuss our next survey. And then Karen announced the 2018 leadership conferences that are coming up. And then David gave a report, David Verner gave a report on organizational goals and our system report card review. And I have a motion for approval of our board calendar. I move approval of the board calendar for the 2018 board year as recommended by the Governance Committee.
Second. We have a motion, a second. Any questions? Hearing none. All those in favor signify by saying yes. Yes. Opposed? All right. We have a 2018 calendar.
And that concludes my report, Mr. Chairman.
All right. Thank you, Mr. Carter. Next up is the Finance Committee. Jim Meister, Chairman.
Thank you, Mr. Chairman. The minutes of the August 30th, 2017 meeting of the Finance Committee were approved. Bill Volgen, our Chief Financial Officer, presented to the committee a resolution recommending the administration of the Sarasota Memorial Healthcare System be authorized and empowered to take steps including opening, operating, and maintaining accounts with banks that have Florida status as a qualified public depository as necessary to efficiently and effectively manage the assets of this district. And I turn to our counsel for a motion to read the resolution.
So I'm going to publish the resolution for y'all to vote on. Whereas the Sarasota County Public Hospital District, the district, is an independent special district established by special act of the Florida Legislature and governed by the Sarasota County Public Hospital Board, the Hospital Board. And whereas the enabling legislation of the Sarasota County Public Hospital District, Chapter 2003-359 Laws of Florida, the enabling legislation, authorizes the monies and receipts from the operation of the district to be deposited in a bank or banks designated by the board to be paid out as established by the board, And whereas the board desires to designate such bank or banks and to authorize its administration to take such steps as are necessary to effect the resolution, now therefore be it resolved that the board hereby designates Wells Fargo Bank N.A., PNC Bank N.A., Bank of America N.A., and such other banks as have Florida status as qualified public depository designated banks as banks into which the monies and receipts from the operations of the district may be deposited and from which such monies and receipts can be paid out consistent with the enabling legislation and the policies and procedures of the board, and that the administration of the Sarasota Memorial Healthcare System be authorized and empowered to take steps pursuant to this resolution, including opening, operating, and maintaining accounts with designated banks as necessary to efficiently and effectively manage the assets of the district. Then Mr. Hudson, speaking on behalf of the board as Secretary of the Sarasota County Public Hospital Board, will certify that the above resolution is a true and correct copy of the resolution adopted by the Sarasota County Public Hospital Board at its regular meeting held November 20, 2017.
Do I have a motion to move that resolution?
I would move that resolution.
Second? Second. Okay, any questions, comments? All those in favor of the resolution, please signify by saying yes.
Yes.
Opposed? Alrighty, motion passes. Jim,
May I continue?
anything further?
Thank you. Tom Perigo, our Director of Architecture, Construction, Renovation Services, presented for the approval the ranking recommendations made by the selection committees for 3 capital projects. And these are broken into several motions, which I'd like to read, Mr. Chairman. First, I move approval of the selections for the design and construction of the Lorraine Corners Medical Office Building as ranked by the selection committee in the public selection process and recommended by the finance committee as follows. For architects, engineers, the Lawson Group Architects, Inc., PRA, Carlson Studio Architects, and RS&H, Inc. And for the general contractors, William Smith Construction, Inc., DeAngelis Diamond Construction, LLC, and J2 Solutions, Inc. And I'd ask for a motion and approval.
I would so move.
Second.
Okay. All those, any question, comment? All those in favor, please signify by saying yes.
Yes.
Opposed? Okay.
To continue, I move approval of selections for the project management firm for the Laurel Road and other related projects as ranked by the selection committee in the public selection process and recommended by the finance committee as follows. Holmes or Hames Company, Adams Management Services Corporation, Stantec Consulting Services.
Do we have a motion, second?
I so move.
Any questions, comments? All those in favor, please signify by saying yes. Opposed?
And I'll continue. I move approval of the selections for the design and construction of the Laurel Road project as ranked by the selection committee in the public selection process and recommended by the finance committee as follows. For architects and engineers, FLAD Architects, Inc., HKS Architects, Inc., and Gresham Smith and Partners. For the general contractors, Gilbane Building Company, J2 Solutions, Inc., Turner Construction, and DeAngelis Diamond Construction, LLC.
So move.
Questions, comments? All those in favor signify by saying yes.
Yes.
Opposed? Okay.
To continue, Nelson Lane, our controller, presented for approval the updated list of recurring wire transfers and HCH and other payments for the hospital, which is done every year. Nelson described the control mechanisms, both internal and external, are in place to ensure our properly authorized transactions occur. And I move approval of the updated list of reoccurring wire transfers and HCH and other payments to authorize staff to initiate and authorize as needed as recommended by the Finance Committee.
So move.
Okay. Questions, comments? Hearing none, all those in favor signify by saying yes.
Yes.
Opposed? Okay, motion passes.
Jim Bugish and David Patterson presented a request for $220,000 for additional funding for the replacement of the EP Lab number 1, which originally was approved by the board in November 2016 at a cost of $2 million. The additional funds would allow the overhead boom system to be modified from single mount 2-head booms to separate individual booms. This would resolve any issue found in the EP Lab 2. The additional funding will also allow us to address some unforeseen building issues. Mr. Bugas proposed a transfer of $220,000 of previously approved budget funds from the Cardiovascular Information System Replacement Project. This project will be completed with a reduced budget. And I move approval of the additional $220,000 in funding for the Electrophysiology Lab number 1 project through a budgeted neutral transfer of the funding from the CVIS Replacement Capital Project.
So moved.
We have a motion and second. Any questions, comments? All those in favor signify by saying yes.
Yes.
Opposed? Okay. Jim?
To continue, Charles Bauman, Chairman of the Community Health Corporation, gave a presentation on the mission and activities of the Community Health Corporation. Mr. Bauman discussed how CHC works in support of the Sarasota County Public Hospital District and engages in healthcare-related business activities as they are the benefit to the district. We've already had prior the approval of the purchase of units 103, 104 of Doctor's Gardens, which I think have already been memorialized.
I don't think we voted on it. We just put it on the agenda.
Okay, sorry. I will do that. So Bill Volgen presented a request for authorization to purchase units 103 and 104 of the Doctor's Garden office building located across Arlington Street from the hospital. The combined cost of both units is $300,000 plus closing. I move approval of the grant of authority to administration to execute such documents and take such steps as necessary to close the purchase from the Diocese of Venice of units 103 and 104 Doctor's Gardens for $300,000 plus related costs as recommended by the Finance Committee.
So moved.
We have a motion and second. Any questions? All those in favor signify by saying yes.
Yes.
Opposed? Okay.
Mr. Chairman, I abstain.
You abstain. Very good. Thank you. Jim, I think we have
Mr. Chairman,
we have one resolution that we failed to give you. So I'm going to
Yes.
ask Carol Ann to read that and on your behalf.
I know, somehow missing in the mix was the motion for approval of selections for the design and construction of the 609 South Tamiami Trail Building, and the committee recommendations on that, which I would then ask that, Mr. Meister, that you propose a motion, and you can just adopt what I say, because you're not going to remember. For the architect and engineers are Lawson Group Architects, Inc., Sweet Sparkman Architects, Inc., Studio Plus Architecture Corporation, and for the general contractors, J2 Solutions, Inc., DeAngelis Diamond Construction, and Gates Butts Institutional Construction, LLC.
I propose the motion.
Second? Second. Okay. Any questions, comments? All those in favor signify by saying yes.
Yes.
Opposed? Alrighty. Jim, you're all set?
That concludes my report, Mr.
We
Chairman.
recovered well. All right, thank you. David, President's report.
Thank you, Mr. Chairman. I'm going to start today looking at our organizational report card. I will just briefly remind the board that this is looks vaguely familiar to last year's report card because we just adopted the new one about an hour ago, and so I used last year's indicators for this. We'll update it next month. With that all being said, we start in our service pillar and we look at our HCAHPS inpatient number of domains at greater than or equal to the 50th percentile. We had a goal last year and next year of being 8 out of 11. Happy to report that we did come in at 9 out of 11 for the month. On the outpatient side, we have a goal of being 55 out of 58. am happy to report that we are exceeding that goal, and we're at 57 out of 58 for the month. In the people pillar, we had, once again, it's the same goal as we had last year, is a turnover of part-time and full-time employees within the first 12 months of hire. We have a goal of being at or below the 25% turnover. We did spike up a bit this month and are at 26.37%. Quality pillar, our infection prevention, which is our overall combined overall standardized infection rate. We have a goal of being less than 0.95. Happy to report we did meet that goal and exceed it, and we're at 0.88. In the finance pillar, as our CFO, Mr. Wojcik, reported, we have a operating margin or budget or a goal of 5.1%, and we are having a projected, we are projecting to exceed that at 5.6%. In the growth pillar, our first one is a strategic growth organizational goals is inpatient admissions plus observation outpatients. We have a goal of being at 38,899, and we are projecting to exceed that at 44,689. Also, outpatient registrations, we have a goal of 799,000. We are projecting to exceed that at 802,745. Looking at our HCAHPS report for this past month, we are looking pretty good this month. We had hit 9 out of 11 of our domains, missed on 2 being cleanliness of the hospital environment and quietness of the hospital environment. Still, lots of work goes into all 11 of those domains all the time by our staff. In the service area, last month we had 850 people who showed up and showed their support for the annual Key to the Cure hosted by Saks Fifth Avenue and the Sarasota Memorial Healthcare Foundation. The event raised more than $200,000 to support Sarasota Memorial's women's cancer program. So, Mason, thanks to you and your staff for helping make that such a success every year. And what was the total that we have for that event overall? It's over $1 million. Do you remember the number?
Yeah, it's like 1.5.
Yeah, around $1.5 million. So it's certainly a great thing our community turns out for. Continuing in service, Sarasota Memorial staff, friends, and family had a great turnout for the recent Making Strides of Sarasota Humanity. The event, which takes place annually during the Breast Health Month, raises funds also for the American Cancer Society. In the quality area, I'm happy to report that Sarasota Memorial is one of only 3 hospitals in Sarasota and Manatee counties, and among 832 across the nation that received an A in the fall 2017 report for its commitment to keeping patients safe and meeting the highest safety standards. The report uses 27 measures of hospital safety data to assign an A, B, C, D, and F grades to U.S. hospitals twice each year. SMH also earned 8 grades in Leapfrog Spring 2017 and Fall 2016 reports. Staying in quality, for the past year, Sarasota Memorial has been the only hospital in Florida with a federal government's highest 5-star rating. In its latest updates this fall, the Federal Centers for Medicare and Medicaid Services also bestowed 5-star ratings on Sarasota Memorial's Nursing and Rehab Center and the Home Care Program. U.S. News and World Report also recently included Sarasota Memorial's Nursing and Rehab Center in its 2017-2018 Best Nursing Homes report, in part because of this, the CMS rating. In addition, Sarasota Memorial Home Care was recognized in the 2017 Home Care Elite, a national list of top-performing home health agencies in the United States. So congratulations to our staff that take care of those patients and make that happen every day. So in the people sector, on October 24th, Sarasota Memorial Healthcare's hospital's medical staff appointed the medical executive officers for 2017-2018. Kyle Gardner was named our chief of staff, serving as the top representative of Sarasota Memorial's more than 900 medical staff members, and he succeeds Scott Stevens. Dr. Gardner, who has also served as chair of our OBGYN section for years, has been a member of SMH's medical staff since 2006. Joe Seaman was named Chief of Staff-elect, while John Yaneri was named Secretary and Treasurer, and Karen Hammond and Jeff Sell were named members at large. Dr. Gardner, we welcome you and thank you for agreeing to serve.
Thank you for having me.
Sarasota Memorial's medical staff also honored 2 physicians for outstanding service to the hospital and to our community. Sarasota Pediatrician Catherine Keeley was awarded the 2017 Lifetime Achievement Award, while interventional radiologist Scott Perrin was named 2017 Physician of the Year. Both were selected by a committee of physician leaders and recognized at Sarasota Memorial's annual medical staff meeting last month. So congratulations to Dr. Keeley and Dr. Perrin for both of these are well-deserved recognition. Staying in people, the Pine Shores Presbyterian Church Adventure Camp stopped by the Sim Lab recently as part of their Hero Day to learn about the many heroes who work in the hospital. And I suppose they practiced on the poor guy, the sim guy in that picture. But anyway, it's always good to have the kids here. Our Volunteer Services Open House. Volunteer Services recently hosted a very special open house to give interested community members a firsthand look at how they can make a difference in patient lives. More than 40 people attended, with many signing up on the spot. And just an added additional message to our community and a thanks to our volunteers. We have over 700 volunteers here. They make a difference each and every day. And we would have a hard time running this organization without them, and we would certainly welcome more coming in. So Sarasota Memorial also welcomes new physicians and bids farewell to longtime pediatrician Dr. Shamsey. First Physicians Group recently welcomed Jose Tavares to FPG Pediatrics at Lakewood Ranch. He succeeds longtime pediatrician Robert Shamsey, who retired last month after more than 42 years taking care of children in our community. So board certified in pediatrics, Dr. Tavares comes to us from Mississippi, where he served as chair of the pediatrics department at Merit Health Gilmore Memorial Hospital. First Physicians Group also welcomes Sarah to our internal medicine and pediatrics office in Osprey. Board certified in internal